Hyperemesis gravidarum, do you have it? Overview. Hyperemesis gravidarum, HG, is when extreme, persistent nausea and vomiting occur during your pregnancy. It can lead to weight loss and dehydration. What's the difference between morning sickness and hyperemesis gravidarum? Morning sickness is extremely common during pregnancy. Up to 80% of people report experiencing it. It tends to subside or disappear completely after 12 weeks of pregnancy, the first trimester. Hyperemesis gravidarum causes you to vomit several times per day. Symptoms of HG often last longer than morning sickness. You might need treatment in a hospital with IV fluids given intravenously, or through your vein, if you become dehydrated. Symptoms and causes. What are the symptoms of hyperemesis gravidarum? Severe nausea. Vomiting more than 3 times per day. Losing more than 5% of your pre-pregnancy weight. Not being able to keep food or liquids down. Dehydration. Feeling dizzy or lightheaded. Peeing less than normal. Extreme tiredness. Fainting. Headaches. However, rising hormone levels are most likely what causes it. Specifically, HCG, human chorionic gonadotropin, which your body makes during pregnancy, very quickly and in large amounts. Who is at risk for hyperemesis gravidarum? Having a multiple pregnancy, twins, triplets or more. Being pregnant for the first time. A biological family history of severe morning sickness or HG. History of motion sickness or migraine headaches. Having gestational trophoblastic disease, GTD, which involves abnormal cell growth in your uterus. What are the complications of hyperemesis gravidarum? When you're vomiting so frequently, it's hard for your body to get the vitamins and nutrients it needs. This could lead to complications like preterm birth or low birth weight. You may also have bleeding in your throat or other side effects from excessive vomiting. Diagnosis and tests. How is hyperemesis gravidarum diagnosed? Your healthcare provider will ask about your symptoms and medical history and perform a physical exam. Your provider might order blood and urine tests to check you for dehydration. They may also use ultrasound to see if you're carrying more than one fetus or have signs of GTD. Management and treatment. How is hyperemesis gravidarum treated? Lifestyle changes. These changes might include wearing a pressure point wristband, acupressure bands, or eating ginger chews and drinking ginger tea for nausea. Dietary changes. Small, frequent meals, every 2 hours, of bland, dry food can help with nausea and vomiting. Anti-nausea medication. Some over-the-counter, OTC, medications can help with nausea. Pyridoxine, vitamin B6, and doxylamine, Unisom, are the most common. Don't take any medications for nausea or vomiting without talking to your provider first. Avoiding triggers. You may notice certain things make you more nauseated, like specific smells or riding in a car. If your vomiting is excessive and you become dehydrated, you might need to stay in the hospital. The most common prescription medications for nausea and vomiting are promethazine and metoclopramide. Ondansetron is another drug that can help with nausea and vomiting. Intravenous fluids. Your provider will deliver fluids and nutrients to you using an IV in your arm. Total parenteral intravenous nutrition, TPN. The most severe cases of hyperemesis gravidarum might require that nutrients be given through an IV that bypasses your digestive system completely. Can hyperemesis gravidarum go away? It's possible that your symptoms subside after the first trimester. Prevention. No, you can't prevent hyperemesis gravidarum. Outlook, prognosis. How does hyperemesis gravidarum affect the fetus? If your provider is monitoring your pregnancy and you're receiving treatment, HG usually doesn't affect the fetus. Are there any long-term effects of hyperemesis gravidarum? Most people have no effects of hyperemesis gravidarum after delivery. While you're at higher risk for having the condition in subsequent pregnancies, you shouldn't feel any symptoms once your baby is born. Is hyperemesis gravidarum a high-risk pregnancy? Yes, your provider will likely treat your pregnancy as high risk. What is the best thing I can do for hyperemesis gravidarum? Follow your provider's advice on other things you can do to help yourself feel better at home. Eating small meals every few hours. Eating bland foods. Avoid fatty foods. Using a pressure point wristband, vitamin B6 and/or ginger to help with nausea. Avoiding triggers like riding in cars. When should I see my healthcare provider? Have nausea that lasts all day and keeps you from eating. Vomit 3 or more times per day for several days. Lose weight. Feel dizzy, faint or confused. Aren't peeing or if your pee is very dark. Hyperemesis gravidarum is extreme morning sickness and causes you to vomit several times per day during pregnancy. In severe cases, it leads to dehydration and may cause premature birth. With treatment, most people can find relief from their symptoms and get the nourishment they need to support their pregnancy. Talk to your healthcare provider if you feel extremely nauseous or vomit several times a day during pregnancy. They can help you feel better and get the nutrients you need.